Well, my father was one of the original incorporators of the hospital back in the 50s, and he died in 73. And shortly after that, I got a call from R.R. Osborne, who was one of the principal supporters of the hospital, asking me to join the board. And of course, Mr. Osborne asked, you do it.
Well, initially, when I joined the Miami County Hospital Board, it was really to bring a voice to the southern market for the people that we serve in rural areas.
Yeah, there were a couple of reasons I was kind of anxious to get involved. One is just to expand my horizons, but more so was just an opportunity to give back to a community that's been so great to me and my family.
I worked for a company that once you became an officer at the company, they required all their officers to be members of nonprofit boards in order to support the community. And I was very fortunate. They did an interview and voted so that I could join the board. Very happy.
I think Frank Devisel had asked me several times to consider being on the board. He was very intentional about wanting to increase diversity and have a female on the board. And this was the hospital that I went to and my family went to, decided to join at that time.
Of course, started out in the 50s as a community hospital. It was a very small hospital on Cooper Street. And then we built the hospital on Claiborne, and that was to be the hospital forever. But we were landlocked. I think one of the biggest decisions we made is when we decided to purchase the property where the hospital is currently located. Really gave us the ability to expand, to really add a lot of new facilities. So I think that was a real key issue for us.
One of the things that made me very proud and continues to give me pride is the hospice house. We talked about a continuum of care. That was a gap that we had not filled. And so I would say that I spearheaded the effort to have the hospice house on the campus.
You know, many of our citizens were having to go outside of the community for hospice house care. We realized that was a major need for the Olathe community. And of course, along with that, in 2017, we finished the birthplace here, including a neonatal unit here that we did not have prior to 2017. So the total continuum of care was really one of the most important things that I think was accomplished during my tenure on the board.
Probably 6 years or so ago, I was tapped on the shoulder and asked to be part of a subcommittee, along with Dr. Snyder and Dr. All, to take a look at security that we were providing for our associates and for our patients. And as a result of that engagement, the security department was kind of overhauled, restructured, and we formed a solid relationship with Olathe Police Department. And as a result, I mean, today we have very capable, very visible security all over the campus.
One of the things I'm most proud of is building a strong foundation, financial foundation for the hospital. And that was very important to us, particularly when COVID hit many, many years later. It was a very challenging time, and we built a strong investment portfolio, and it was well managed by a whole group of people, including myself. Really set the foundation for the hospital to do some of the wonderful things it had done over the years.
You know, besides providing excellent health care to the communities, it's also a business. So there's a lot of things, a lot of dynamics of, the financial side of things, and also the branding, because that's my background. It's more what's your reputation in the community? How can we raise our visibility? How can we draw more people in and let them know what services we have? We get a lot of information fed to us from the staff or committees. So we look at that, but I also feel like we've had a lot of opportunities over the years to be involved in direct conversations with doctors and staff, as well as be involved in the community.
I feel like there was a lot of expansion or growth happening, whether it be growing the hospice house, the cancer center, the partnership with Children's Mercy. It was just exciting to see all of the growth, and it was just great to be part of a leadership team that was supporting that.
Healthcare for my community is very important to me. I've raised family in this community. And once I was on the board, so very impressed with the leadership team and the other board members. A lot of them were officers of companies, owners of companies. So I learned a lot, and I loved my time on the board.
I think the board as a whole can be very proud of the impact we've had on the community, and you don't have to look far. I mean, everything from the hospice house to the birthplace with the NICU unit and the cancer center, and on and on and on.
We're not paid board members. We have a strong commitment to what's best for our community. So all decisions really flowed from that. And I'm most proud of hiring really good people, leadership, attracting good physicians through our physician network, and just really building what was a fantastic health system and will continue to be over a long period of time.
Being part of the negotiation team on the change of membership to become part of the University of Kansas Health System, it was a very significant thing for our community, bringing enhanced services. And then I can look at the growth of the system in the 25 years that I was on the board, and can look at the birth center, the cancer center, the pavilion, ambulatory surgery centers, and also bringing in some really top-notch physicians into the system, all of which I feel real good about, and I think the entire board played a big role in that.
Well, we had been an independent hospital for 70 years, and we had done quite well over those 70 years, but the environment was changing, competition was changing. So that's what involved into actually the complete transition that we're going through right now with University of Kansas Health System. But the more I get to know the facilities and ability of the University of Kansas Health System, I really now feel so strongly that we're going to bring a whole new level of care to the Olathe community in our service area.
Not being a community hospital was a very, very difficult decision for the board. It took a lot of discussion, a lot of reflection, but ultimately our role as board members, I feel, is to look after the care of the patients in our community.
We can't stand still. We must keep moving forward. We must keep adding services. In reality, we can't be all things to all people here, but my term on the board, we tried to be that. We tried to provide a total continuum of care to all the citizens of Olathe, and I think largely we've accomplished that.
I'm excited about what the advisory board is going to be able to do as the two systems come together. They have incredible data analytics. They offer so much that we can do together when we collaborate, and it's going to be a huge benefit to the community here at Olathe.
The biggest thing ever has been the combining of Olathe and KU, and that's involved so many people and boards from both sides of the table. But really what that's done is it's really set the stage. It's exciting times. It's going to change the face of healthcare for not only Kansas City, but the rural areas that they serve. And that's really the true legacy that Olathe Health is leaving behind.